Hi everyone, my name is Hari Akbar. Today I want to review about one of the health equipment. The name is Sphygmomanometer. A sphygmomanometer is an instrument used to measure blood pressure, which is also known as a blood pressure meter. There are three major types of sphygmomanometer. The first one is mercury sphygmomanometer, the second one is aneroid sphygmomanometer, and the third one is automatic digital sphygmomanometer. Today, I will explain the aneroid sphygmomanometer. In general, an aneroid sphygmomanometer has five components. Bladder in inside is an inflatable bag that is used to compress the arm to occlude the artery. Cuff is designed to hold the bladder around the arm during the measurement. Manometer is a device used to measure the air pressure in millimeter hectogram. Valve is used as a deflation valve to control the cuff. And the last one is bulb is used to pump the air into the cuff. When we want to measure blood pressure with aneroid sphygmomanometer, we also need a stethoscope too for hearing the systolic and diastolic. How to use sphygmomanometer? The first one is wrap the cuff around the upper arm such that the lower edge of the cuff is 1 inch above the antesubital fossa. Then press the stethoscope bells lightly over the brachial artery which is below the cuff edge, and then release the air from the cuff at the moderate rate to 180 mm hectograph. And then monitor the first knocking sound by listening with the help of stethoscope and also by observing the mercury gauge. This should be done for both the arms and the pressure. The position of the subject and the size of the cuff should be recorded. If the pressure is more, then the blood pressure should be measured with few minutes of gaps between the two measurements.